I'll come in. Be right with you. What can I do for you today? Okay. Are you new to our clinic? Oh, it's fine. What was your name? And your birthday? So it does look like, because you're new to our clinic, we do have some paperwork to fill out. Okay. Nope, that's not a problem. I can actually bring it up and help you fill it out so that your file is fully up to date. Okay, good. Just grab. A lot of these will be pretty standard questions, and some relate to medical history. Send your name already. Okay. So, looks like we're going to start with some allergy questions. Okay, so do you have any allergies that you know of? Yeah, that can be general allergies, foods, medications. Okay. And have you ever experienced an allergic reaction? Do you use an EpiPen? And so you don't have really a date of like a last big allergic reaction or anything like that? Okay, good. That's good. Good. Medications. Are you on any medications? And if so, I need the dose. Okay. How long have you been on that one? That's fine. Anything else? Okay. Any vitamins? Any recreational drug use? Good. Now you may not have the exact dates on some of this, which if need be we can pull them from your previous provider. Okay, and it was out of state, correct? Okay. No, that's okay, we can still do that, but just by chance, do you know the last time your cholesterol was checked? The last time you had a colonoscopy? A mammogram or pap smear? Okay. And have you ever had a bone density test? general idea will help us compare to your medical records, and we'll be able to get the provider and the facility and if there was any sort of abnormal results. Do you remember anything coming back abnormal? Good. Good. Okay. Good. Okay. Okay, so some vaccination history. Do you know the last time you received a tetanus booster? Flu shot? Good. Have you ever required a pneumonia shot? Okay. And have you got a shingles vaccine? Any others? Okay, perfect. So moving on to just some of your personal medical history, if you can just let me know if any of these apply to you currently or in the past, and if there is any notes that you would like me to make for your new provider. Okay? So any alcoholism or drug abuse currently or in the past? Any asthma? Any type of cancer? Depression, anxiety? Have you been diagnosed with bipolar disorder? Okay. Have you been treated for any suicidal thoughts? Okay. Good. Alright, diabetes. Alright. Any sort of emphysema. Good. Heart disease. High blood pressure. Any sort of thyroid disease. Have you had your thyroid checked before? Alright, kidney disease. Migraines. Okay. Do you experience regular headaches? Stroke? Heart attack? And any other things that you would like me to make note of for your chart? When was that? Okay. Now, have you had any surgeries, and if so, what type? Okay. And when was that? Roughly. Okay, good. Perfect. Thank you. Okay. Alright, so, next up, do you know the date of your last menstrual menstrual cycle if it applies to you. Mm-hmm. Do you know the age when you started menstruation? Have you ever been pregnant before? Okay. Mm. Okay. Okay, so kind of moving on to some family history, if you don't mind. So I'm going to be naming off some different things, and if you could tell me if they apply to anyone in your immediate family. So that's going to be your mother, your father, brother or sister, a child, your maternal grandmother, your maternal grandfather, your paternal grandmother, or your paternal grandfather, okay? Okay, so any sort of alcohol or drug abuse, asthma, cancer, emphysema, any sort of mental health problems. Okay. Okay. Good. Diabetes. Any early death from a specific heart disease, high cholesterol, kidney disease, stroke, thyroid, migraines, and any other diseases or complications from your immediate family. Okay, so just a bit of social history for you specifically. Okay, so your current occupation or your prior occupation. Okay. And are you retired, unemployed? Okay. What was the employer's name? What was your highest level of education? Okay. If you are currently employed, do you work night shifts? Yes, no, or not apply? Okay. What is your marital status? Single, partner, married, divorced, widow, or other? Okay. Perfect. Do you have children? If yes, how many? Okay, so just some other health questions for you. Okay, so just some other health issues. Tobacco use. Do you smoke cigarettes? And if yes, how often? Okay. Have you in the past? Okay. Perfect. Alcohol use. Do you drink alcohol? Beer, wine, liquor. How many drinks a day or a week? Okay. Any marijuana use? Any other drug use? Past or present? Okay. Perfect. Have you ever used needles to inject drugs? Perfect. You are just breezing through this. Thank you. Okay, so discontinued other health issues, sexual activity. Are you sexually involved currently? Do you currently use a birth control method? None, condom, pill, ring, patch, IUD, vasectomy, using any sort of protection? Okay. Are you or someone you're involved with trying to get pregnant? Okay. Do you exercise? What kind of exercise do you usually do, and how often? Okay, cool. Usually when you do an exercise, how long does that last for? Okay. Okay. Now for sleep, how many hours on average do you get a night? Do you think you need more? Yeah, don't we all? Good. Do you sleep through the night or are you waking up? Okay. Any sort of insomnia issues currently or in the past? Okay. Any use of a CPAP machine? Okay. Do you snore? How would you rate your diet? Good, fair, or poor? Okay. Do you need any advice on your diet? Okay. Have you gained or lost a significant amount of weight in the last 6 months? Now, just some safety questions. If you ride a bicycle, do you wear a helmet? Do you use seat belts consistently? Do you have a working smoke detector in your home? Okay. Is violence at home a concern for you? Alright, have you completed any sort of advance directive for your health care? Okay. Like a living will? Okay. That's okay. And would you like any information on that? We can definitely give you some information on that if it's something you're interested in. Okay. Make note of that for you. Now, have you seen any sort of specialists in the last 2 years, okay? Have you seen a cardiologist? Okay. Have you seen a GI? Okay. OBGYN? Okay. Neurology? And pulmonary? You traveled outside the country in the last 30 days. Okay. Have you ever served in the military? Okay. Alright. Alright, so I have just a list of things that you may be concerned with or experiencing currently. I'm just going to read that list off for you, and if you can just let me know if it applies to you. Okay? Good. Okay, so any sort of activity change, appetite change, chills, alright, fatigue, fever, unexpected weight change. Now for the head, ear, nose, and throat congestion, dental problem, drooling, ear discharge, ear pain, facial swelling, hearing loss, mouth sores, nosebleeds, sinus pressure, excessive sneezing, sore throat, trouble swallowing, voice change. Okay, for your eyes, any eye discharge, eye itching, eye pain, eye redness, and visual disturbance. For your respiratory, chest tightness, choking, cough, shortness of breath, wheezing. Cardiovascular, any chest pain, leg swelling, and palpitations. Alright, so for your abdomen, any sort of abdominal pain, blood in the stool, constipation, diarrhea, nausea, vomiting. Okay. Any sort of cold intolerance, heat intolerance. Good. Any problems using the bathroom? Any issues with sexually transmitted diseases? No pain or discomfort relating to any sex organs or... Okay. Perfect. Any back pain, joint swelling, neck pain, neck stiffness. Now for your skin, have you noticed any color change, rash, wounds? Have you noticed an increase in environmental allergies? Food allergies? Or are you immune compromised? Now, neurological dizziness, facial asymmetry, headaches, lightheadedness, numbness, seizures, okay, speech difficulty, okay, tremors, and any sort of weakness. Have you noticed any bruises or excessive bleeding? Any sort of behavior problems that you've noticed? Confusion? Decreased concentration? Hallucinations? Hyperactive? Nervous or anxious? Sleep disturbance? Any suicidal ideas? Perfect. No, I think that is all I needed from you today. Let me just make sure while I have you here. Now, did you have any questions for me? Any other additional notes you would like me to provide on your chart for your doctor or specialist? Okay, perfect. Well, thank you so much for bearing with me through all the paperwork. I know it can be kind of annoying sometimes, but I do appreciate it. And you are all set for your first appointment. If we have any questions, is there a good number I can reach you at? Is that a cell phone? No problem. Okay, perfect. Well, thank you so much for coming in. I hope you have a fantastic rest of your day. Alright, you take care now.